Hello, my name is Matt Sindred. Thanks for joining me on Discover the Three-Step System, helping golfers manage their frequent back pain and get back to the course without invasive procedures, pharmacy refills, or time off from golf. Let's get started. So make sure you turn on your sound, have a piece of paper and pen handy so you can take some notes, because what I'm about to share with you will change the way you think about how to solve your back pain, even if you've tried many different things already, like physical therapy, chiropractic, medications, injections. I want to break this down for you so that you can understand that there's a lot of different ways to get better, and the regular medical system's not really helping us with that. Was there a time when you could play around a golf and not fear hurting, when you could swing freely without pain, and were more active on and off the course? This is for you if you're a golfer and want to overcome your back pain. You've tried traditional therapy that didn't help, but you know there is a solution out there, and you want to play golf without medications, injections, or visits to the doctor. In the picture on the left, I'm using a coffee mug to demonstrate a cross-threaded core. In a few minutes, I'm going to share with you why this matters and how it can help you with your back pain. So the bottom picture with the water bottles is actually showing how I can help people with different shapes and sizes. So each water bottle has a different orientation, like skinny and tall, short and round, doesn't matter. These principles work with anybody that's having back pain. So I'll talk a little bit more about stacking the core later on in the presentation. This is my promise to you. You'll discover the three-step system that'll help you overcome your back pain and get back to golf in as little as 4 weeks without medications, injections, or trips to the doctor. So you can get back to golf and swing freely, enjoy time with friends and family, and enjoy golfing wherever and whenever without the fear of pain. Can you relate? Are there days you wake up wondering if you'll be able to manage your back pain enough to get on the golf course? Have you been to the doctor, physical therapist, and/or chiropractor and tried medications, injections, and/or core strengthening without long-term relief? Are you tired of having to spend 20, 30, or even 60 minutes in the morning stretching to loosen up your back? Have you experienced pain after golfing that has made you wonder if you'll get to play the rest of your life? It's not your fault. It's not. Back pain is caused by a cross-threaded core. Many in the industry don't understand this. So here's why I say that. When the core, pelvis, and trunk are not aligned, it causes compression of the lower back. With this compression, rotation at the pelvis and trunk becomes difficult and causes stress to the joints of the lower back. And correcting this has nothing to do with sit-ups, crunches, or planks, but I'll explain more in a minute. Here's a study showing limited pelvis and trunk rotation are associated with low back pain. Traditional medicine focuses on masking your symptoms by giving you medications and injections that don't fix the root cause of your pain. Even physical therapists, chiropractors, and massage therapists don't know how to help you long-term because their focus is only on giving you pain-relieving stretches that again don't fully address the root cause. Continuing down this path usually leads to more pain, more injections, more medications, more time stretching, and possible surgeries. I've seen it too many times. If you continue down this route of masking symptoms, ultimately you will continue to break down your spine and ultimately lose time on the golf course. The good news, I've figured out a simple way to solve this problem, and I'll walk you through it in this training. These 3 boxes are the key to your success, and they're the 3-step system. Okay, we're going to get into it a little bit more later. First, here are some testimonials of people in the program. Russ Holden, who's the former coach and caddy for Bernard Longer. It has been my distinct pleasure to work with Dr. Matt Sindred on not only my body, but my golf swing as well for some time now, being a life PGA member and having the privilege of teaching and working with 2 World Golf Hall of Fame members over my career. I've seen it all, or at least I thought I had. Matt is as perceptive as anyone I have met in this game with over 40 years as a professional. He understands virtually all aspects of the body and training and has helped me immensely fight off father time and continue to play at a high level. He has my highest recommendation for anyone with an injury and wants to recover properly, or anyone looking to gain strength and speed in an incredibly kind and impressive fashion from Matt. Thank you for all you have done for my back and my body, Matt. Carry on. Russ is a 66-year-old, played golf, and again, professional for over 40 years. He had many people telling him he was too old, and that's why he continued to hurt. But what we really found out was he had identifiable deficits that we could work on and get him back to golf. Here are just a few other examples. Matt at the top left, he's a former professional baseball player. Matt's knowledge of the games of the golf swing is as good as it gets, shaving a ton of strokes off my game. As someone who is stiff, Matt caters to my specific deficiencies and drills, with drills and movements to free up the golf swing, allowing me to hit it further and straighter. Again, athletic person that's golf is their second sport. Dylan Wu, who's a PGA Tour player. Luckily enough to meet Matt at the beginning of my professional career when I was visiting KC, a great guy who loves golf and really helped me understand my body and give me insights on how to take care of my body and tendencies. If you're ever in Kansas City or want to work with him online to help improve your game and health, he's your guy. And then Smart Golf Academy, Tony McMullen. What Dr. Matt brings to the table here can help golfers to achieve their physical and scoring goals both efficiently and in short order. His ability to combine movement mechanics with his knowledge of the golf swing is a roadmap to success on the golf course and the scorecard. If you're looking to improve in any area of your game or your health in the game, you'll want to get an appointment with Dr. Matt as soon as possible. So those are some professionals. Now, many of you probably saw this when you signed up for this call. This is Dave. He's an in-person client I've worked with. He's got a long history of issues with back pain. 3 months ago, Dave was dealing with back pain while playing golf. Now he's able to play as much golf as he wants without pain. He thought it was a long shot, but it worked. He was able to play 198 holes in an 8-day stretch without a single instance of lower back pain. How to get these results? He followed the program. I want you guys to learn how to take control of your back pain, play more golf, and the byproduct for many, like Dave would say in this video, 20 to 30 yards of distance, just by moving more efficiently to take pressure off the spine and improve your body's movement. Steve Pope, local firefighter, fire captain in Kansas City that I've worked with. Matt has helped me with my setup and sciatica issues. He showed me how to get stacked properly to rotate more freely and reduce strain on my lower back. This has also increased my driver's swing speed by 3 to 4 miles per hour. So not only are we getting back pain to go away, but this stacking of the core improves consistency, it improves speed, it improves rotational velocity. So we not only get better with the back, but better with distance and overall game. So with this program, you'll wake up in the morning with less back pain and tightness. You'll spend less of your morning stretching to get ready for your day. You'll be able to play more golf without medications and the fear of back pain keeping you off the golf course. The best part, you don't have to spend hours per day stretching and working out. You don't have to spend time in the physical therapy or chiropractor's office. You don't have to go to the doctor for more pills, injections, or testing. And even if you have tried previous treatments, this method gets results. And the only reason I can share this with you is because I've been through this, the good, the bad, and the ugly. I'm Matt. I'm best known for helping golfers with back pain overcome their pain and get back to the course. Here's just some credentials of where I went to school, what extra training I've had. Again, I've done this, I've been through it, 16 years in practice as a physical therapist. My sole focus is to help golfers with back pain at this point in my career. Even though I'm now a sought after expert in this area, I want you to know that things certainly weren't always this way. Let me show you what I mean. After a few years of being a physical therapist, I was frustrated because many of my patients weren't getting better, and they were getting poor advice and poor results with the traditional medical approach. I tried everything. I took hundreds of hours of continuing education, spent tens of thousands of dollars on going to specialists and learning from people and courses and the gurus. A shadowed specialist to hone my skills, to ask them questions. I've worked with physicians to better understand the advice they were giving to our patients. And I remember the patient that changed everything. I received a referral for a 55-year-old golfer that was having chronic back pain for 30 years. He was never really injured. He didn't fall off a ladder. He didn't get run over in football. He enjoyed working out and played sports as a kid. He was health conscious and always wanted to keep his body healthy so he can retire and play golf every day. He went through all the standard protocols that were best practice. He was able to manage his pain with stretches and over-the-counter medications in his 30s. He had his first x-rays in his 40s, and they noted early on arthritis, mild arthritis. So he was sent to physical therapy, did stretches, core strengthening that were prescribed by the doctor. And then a few years later, he had even worsening pain, and he got an injection. Now at 55, he's seen me because he has severe stenosis and breakdown of the spine. We're now talking about surgery. His fear is that he's not going to be golfing into his retirement as he'd wanted to when he was younger. He's a hard worker. He wanted to pay off for that at the end of his life. But why did he have this issue come up? How could the medical field be failing this guy? I was so frustrated. I felt sympathy and anger for this guy. I was just trying to figure out why can we in the medical field not solve this problem? So here's an example I like to give to all of my cases. You have a fever. The best way we know to treat a fever a lot of times is just take some Tylenol. But what happens if you take Tylenol and the fever goes down but comes back up, and you take Tylenol again and the fever comes down and it comes back up, and this is happening for 7 days, 10 days, or more? Well, what that is you are using Tylenol to treat a symptom, not a disease. So the disease in this scenario, let's say you go to the doctor finally after 7, 8, 9, 10 days of taking Tylenol and going, I just can't get rid of this fever. Well, the doctor finds out that you have a bacterial infection. So instead of taking Tylenol, what we really needed to be doing was taking an antibiotic medication to solve the real disease. Same thing happens in the low back often, where we see people with back pain and the prescription for that is medication, or it stretches to the back, or it's core strengthening. But in reality, most back pain is not caused by the low back itself. It's caused by the low back working too hard because another area is not working hard enough. In many cases, hip tightness or leg strength can be a big predictor of low back pain. His case sent me on a journey, and I finally found these answers, and I finally understood, hey, we need to find the disease. We need to find the cause of the back pain, not just treat symptoms. And like I said before, I discovered that the back itself is not the problem. And through a lot of trial and error, I eventually figured out a better way to solve the underlying problems that was preventing the result. Now I get to work full-time with golfers, helping them get back on the course without pain, just like Dave. Remember his story? Dave had seen doctors, chiropractors, physical therapists, and other so-called golf performance specialists for exercises, and he continued to deal with back pain. It actually took him understanding that stacking the core, which we're going to again talk about in a minute, was so important to allowing his back to move freely when he played. This actually helped all aspects of his life. He was able to play more with his 11-year-old grandson. That's where all those holes in 8 days came from. His 11-year-old wanted to go on a trip and play golf, so he wanted to do it with him. He was able to do that. He would not have done that before the program, he said. He could not even play 2 days in a row before we started working together. Now Dave spends less time stretching and more time playing golf. He's not taking medications and going to too many doctors visits for his pain. And ultimately, he was thinking he needed a surgery, and he no longer thinks he needs it and will not need surgery. Listen, my clients are not superheroes, just regular guys who are committed to getting results once and for all. So if they can do this, you can too. I have clients from age 34 to 79. So if you want to get better, I can help you. Imagine how amazing it feels to wake up in the morning without the fear of pain limiting your activities for the day. What life looks like when you can go to the course and play 18 holes with more energy and freedom in your swing. What your buddies will say when you not only lose the pain but also gain 20 to 30 yards off the tee because you can swing freely. The real problem is the back pain is caused by this cross-threaded core. The 3 discoveries I made about eliminating pain. Discovery 1, sit-ups and crunches to strengthen your core is not the answer. Think about Tiger Woods. He has a six-pack bulked up abs because he did a lot of sit-ups, but still suffers from back pain. Bodybuilders don't rotate well. That muscle in the front actually causes more compression in the spine because it goes vertically. So here on this slide, I'll show you that. The muscle runs up and down. So when it contracts, it also contracts with the back muscles, and it leads to compression of the joints. If I compress something, I can't rotate. The goal of your core is to have the correct alignment to allow for freedom to rotate. So this water bottle or this coffee cup example on the left, I'm using it to show that if the pelvis and the thorax, your ribs and your hips are out of alignment, the force is going to go into the lower back. If we put those two joints in alignment, the ribs and the pelvis, we're going to actually be able to rotate. So the sit-ups and the crunches do not help with the rotation. They do not get you in the right alignment. What they do is they cause compression and can oftentimes cause more dysfunction in your lower back. The second discovery was stretching is overprescribed and underperforming, and it can hurt your golf swing. So strength training actually improves flexibility, and research shows that many times you can get more flexibility and stability in your golf swing by doing strength training. So you see here like 25% improvement in X factor stretch rate in 9 weeks with a strength training program. Okay. Improvement in shoulder stretch is 25%. 20% improvement in shoulder stretch rate. 19% improvement in X factor stretch. Here, this shows that functional training improves club speed and functional fitness in older golfers. So functional training is equal to strength training the whole body, and it also helped improve mobility as well as power and strength. So why spend so much time stretching when that's not solving your problem? The last discovery was over-rotating and other pro positions are making your back pain worse. Too many instructors are teaching to swing like the pros. Think about the common phrase, getting open impact. Many of us average guys don't have the mobility in the hips as the top pros. Us average guys are just Corollas. We have many different responsibilities to do. We have families, we have jobs. Maybe we're later on in our lives and retired and just hoping that we can get from one place to another correctly. Versus a Dustin Johnson or a Brooks Koepka or these high level athletes that are like Formula One cars. They're finely tuned. They only have one job. You're not going to the grocery store in your Formula One car. Okay. So they need to have a different training and different type of swing, and they can control that because they are purposely making their bodies for one activity, working out for one activity. This study shows that despite golf being a low impact sport, 60% of professionals and 40% of amateurs suffer from an injury each season, which a high number of these are lower back pain. So we definitely need to make sure we're working on strength training to improve that injury prevention and to reduce injuries. Remember this slide I showed you earlier? Now I'm going to show you the 3-step system that will help you overcome your back pain and get back to the course. It's called the Back to Golf method, and now let me walk you through the steps. The first step is to stack the core. This is where we get the proper alignment of the core to reduce compression on your lower back when rotating. The next step is to build support. This is where we strengthen around the properly aligned core and gain golf strength, mobility, and power. The final step is to swing freely. This is where we work on swing drills and golf power sources other than the spine to reduce the demands on your back so you can play more golf. Remember Russ? He's a 66-year-old lifelong PGA member. He was getting back pain when he was waking up. He was not able to play golf because of his right low back pain. He tried chiropractic, massage, and PT. He reached out to me after watching my webinar, and he was just frustrated at that point because many of these specialists were telling him he was just getting old. Can you imagine that? That makes me mad. So again, we identified a problem. We saw that he had deficits. We addressed those deficits. He got better. You can do that at any age. I see back pain at 15-year-old athletes. I see back pain with so many different body types, thin, bigger, taller, shorter. So I don't like that specialists out there and doctors tell people that they're getting old, because in all reality, there's older people that don't have back pain and there's younger people that do have back pain. So we've got to change our mentality to get better. And that brings me to why you're here, because you're committed to getting rid of your back pain and back to the golf course, even if you've been told that you're too old or you're not able to because of your back. And if you're anything like me, you put a high value on your time. And you've probably enjoyed success in other areas of your life by focusing on things that get you results. You now know back pain is caused by a cross-threaded core, and I've shown you the back to golf method. We've also seen that the old way of doing things simply doesn't work. Treating the symptoms does not treat the disease every time. The best way forward is to stack the core, build support, and swing freely. Because it's proven to give people just like you the results they want. You can do this. We can do this together. Just imagine how great it'll feel when you no longer have to struggle with back pain and no longer have to miss time on the golf course. How good it feels when you wake up in the morning without back pain and can focus on playing your best golf that day. And if you'd like me to help you do this, I'd be delighted. Let's get this done. Because there's one thing I know for sure. Doing this alone isn't easy. You could try, but you'll probably waste a lot of time, money, and needless frustration. It'd be like trying to drive across the country without a GPS or any signs on the road to tell you where to go. Here's why. It cost me tens of thousands of dollars in 16 years to create a solution that actually works. What you've tried so far hasn't worked. And the devil is in the details. Do you want to spend that money and time and become the next expert on back pain? I didn't think so. That's my job, not yours. You just want the end result, and that's why you're here, right? And we both know that you can only get so far on your own. After all, I don't know any high-level athletes who got to the top by themselves. Do you? Who's going to keep you accountable? How will you know the right exercises to perform? How will you know what exercises to do in what sequence? Let's be honest. You're here because you know that other avenues like medications, traditional therapy, injections just haven't cut it. So does doing more of that sound like a smart plan? Probably not. Sadly, most type of physicians, physical therapists, chiropractors don't understand this issue that you're having. I've done my best to share what I can with you here to show a better way that's worked for my clients. But the reality is everyone's unique and your situation can be different from someone else's. And unless you're the expert who can identify those nuances, it's going to be really tough to improve your situation all by yourself. So successful people figure out what they want and why they want it. Then ask who, not how. Let me explain. If you had a leak in your roof, would you figure out how to fix it? If you did, that would likely involve you going to Home Depot, buying some shingles, climbing up onto the roof of your house with little idea of what you're doing, and somehow fix your roof. No sane person would do that. Unless, of course, you love DIY work and are super handy around the house. I'm not. But this type of thinking really holds people back in life because they try to DIY their way to better health and fitness, all to save a few bucks. And although it may eventually happen, the road is filled with mistakes, lost time, tons of frustration, and eventually a lot of money down the drain. Money is cheap, time is expensive. Successful golfers with back pain don't waste time trying to figure things out on their own. They look for their who, the expert who will lead them to the results that they want. They ask, who can help me fix this problem? That's a smarter question to ask, isn't it? And you're just a phone call away from the help you need. So here's exactly how I can help you. My team and I have set aside some time on our calendar to speak with you personally, absolutely free, about how you can apply these strategies right away and start getting results. On this free Back to Golf call, we'll do three things. First, we'll get clear on what you really want. Second, and most importantly, we'll uncover the specific challenges that have held you back in the past. In most cases, people are not clear on these. That's part of the role as a coach, is to help you see them. Third, once we know where you've been, what's holding you back, and where you want to go, then we'll put together a game plan to help you reach your desired goals. And if you'd like to get there faster and without frustration, then we can talk about what it would look like to work together. Remember those case studies I showed you earlier? Just like Russ, Steve, and the golfers I've helped get out of pain and back on the course, I would love to help you get there as well. So, if you want to eliminate your back pain, if you want to play more golf, and if you want to do it all without medications, injections, and frequent trips to the doctor, then this is for you. And if, in case you're wondering why I'm offering this free call, it's because I love speaking with people who are taking full control of their health and are ready to finally solve this problem once and for all. I know that a good percentage of people I speak with will want to work with me so they can meet their goals in the fastest amount of time possible. If that's you, amazing. If we mutually decide it doesn't make sense, then that's okay as well. It's a no pressure, no risk phone call. But before we go any further, you need to know that I can't help everyone. And the last thing I want to do is waste your time if you're not the type of person who will see results. Based on the hundreds of people I've helped, I know there are certain types of people who will get results and those who won't. This is not for you if you don't have a minimum of 3 to 4 hours per week to dedicate to the program. This is not for you if you're constantly looking for quick fixes. This is not for you if you're unwilling or unable to invest your time, energy, and money necessary to get your health back. This is for you if you are someone who is fully committed to taking control of their pain and health. This is a priority for you now, and you are self-motivated and take 100% ownership of your results. This is for you if you see the value in making your health a priority to get out of pain and back to golf. So if you meet these criteria, then there's no reason you can't see results, just like Russ, Steve, Dylan, and Matt did. Then this is for you. So just to be clear, my goal is not to pressure you or sell you on anything that isn't right for you. My goal is to act as a custodian to help you do what's best for your situation. Here's what we do next. Schedule a call with me by simply clicking the link below this video. There you'll be able to grab a time to chat in the next 48 hours. Once your time has been selected, you'll then see a form with a few questions I'd like you to answer so I have a better idea of where you're at and where you want to go. That way our call together is as productive as possible. Simply click the link below. So if you want to uncover what's really been keeping you from getting rid of your back pain, get a customized plan to get back to golf, see if working together would make the most sense for you to get even faster results. Time is of the essence. Since I only have so much time to do these calls each week, I don't run a huge call center. This is a first come, first serve opportunity. Once these spots fill up, well, they're gone. So if you're serious about getting back to golf and getting rid of your pain, and you meet my ideal client criteria, click the button below while this is still top of mind. Now, You really have two choices. You can continue doing what you've always done, and sadly, you'll likely get the same results. Or we can jump on the phone and put together a winning game plan that will set you up for success. I've noticed that there are two types of people. The struggler figures out what he or she wants and then asks, how can I do this? They then spend years trying to crack the code, but it sadly rarely happens. Then there's the successful person who actually achieves what they want because they figure out what they want and then ask, who can help me achieve this? They find a mentor, a coach, someone who's already paved the path, someone who can help them get the results faster than they ever could on their own. Now, the fact that you're still here watching this tells me that you're the type of person who is or wants to be successful. So let's finish what you've already started and book a call so that we can help you reach your goals much faster and without all the unnecessary struggle and frustration. You've watched this entire training. You want to be playing golf without the fear of, and you know you're simply not getting the results you want to on your own. So take advantage of this opportunity now. This is a free, no pressure phone call for us to speak about your struggles, your needs, and the direction you need to go. If you are not a good fit, I will still help you understand the direction you need to take your health. Simply click the link below and let's do this together.